Good morning. I'm Dr. Aaron Rogers, one of the physician medical directors of Advanced Hearing Centers. I'm an otolaryngologist in a practice immediately next door and upstairs to the hearing center that Dr. Pickelman runs for us. I wanted to do a quick question and answer with Dr. Pickelman, who is our lead audiologist, so our readers and viewers can have a little more insight as to what a hearing center really does for patients. Dr. Pickelman, can you please tell us a little bit about what a typical hearing evaluation and possibly even a hearing aid evaluation does for our patients and what that looks like to the patient?
Yes, for the patients, first we would like to analyze their hearing with a complete diagnostic audiogram. What that means is we put you in our sound booth, we'll put headphones on your ears, and then we test how well you're hearing. We also do speech scores. It's very easy, nothing to prepare for. And then if a hearing loss is diagnosed, what we would do then is first get a medical clearance by an otolaryngologist if necessary, and we also then discuss hearing device options.
So what would I need to bring to a hearing test or even to an evaluation for hearing aids to have the best possible meeting with you guys?
Well, with the hearing test, you wouldn't need to bring anything. We do free hearing tests in our suite of 144 so that there's no cost to you. The other thing for the hearing aid evaluation, what we recommend is that you bring a family member or spouse, therefore you both can be involved in this decision-making process. What we go over is different designs of the hearing devices, what would be most appropriate for your hearing loss, and everything is individually based.
Got it. What about our patients who maybe don't necessarily have the kind of common gradual age-related hearing loss, but instead have hearing loss related to prior medical treatments or chemotherapy, antibiotics, or even have had ear surgery before? Is your practice the best facility for those patients who've had those pre-existing problems?
Yes, we've had multiple experiences helping restore the quality of life for those patients. There's a lot of different reasons why we can have hearing loss, and we work closely with the patient, what their goals are, and also with the goals of the physician that may have referred them to us.
Got it, got it. And then I know a question on everyone's mind has to do with the cost and price of hearing aids. It's very, very controversial out there as far as how much hearing aids cost and how much insurance really covers for hearing aids, or in most cases doesn't cover for hearing aids. How does the price at such a sort of higher quality medical related institution as this compare to one of maybe hearing aid dispensers down the road or in a strip mall that we see sometimes?
That's a very good question. A true hearing aid will cost a couple $1,000s. That's for a real hearing aid that you can get anywhere else. For the gimmicks that you see for a couple $100s that you can get over the counter, that's what we consider a personal amplifier. So it's not technically a hearing device that could help with the clarity of speech. Where we are different from other companies is that we bundle all of our prices, so there is no surprise cost to you after that initial payment for the hearing device, which is also nice. The other difference is we are a high-level medical facility. We work hand in hand with a otolaryngologist, so we have that multi-practice level quality of care, which comes in handy. And you also have a doctor of audiology fitting the device.
Yeah, it has been really nice since we've been working closely with Dr. Pickelman and other audiologists to try to provide this service coupled with a lot of our medical procedures. It really lets us bundle things, consolidate things, and cut costs as much as possible, bringing hearing aids into a more accessible realm for our patients. So Dr. Pickelman and all the staff at the Hearing Center, how do we find you guys? Is there a website, a phone number that we can easily get in touch with you, or do we have to go through our doctor every time?
Well, that would be depending on your insurance. Some insurances do require a referral. However, we are in the 960 Johnson's Ferry building. Our phone number here is 404-924-4510, and you can just ask for Beth at the front desk.
And we also have a website, I believe, www.advancedhearingatlanta.com. Stacy, thank you very much for our conversation this morning.
Thank you.